Men think hormones are all about T levels. What if estrogen, usually seen as a female hormone, is actually key to men's health? Today we challenge what you believe about male hormones, and reveal how adequate estrogen transforms your health and fertility. Welcome to Levitas. Stick to the end of the video and learn how to keep estrogens in adequate levels, as having too much will backfire. 1. Male organ function. Adequate estrogen in men plays a surprising, yet essential role in intimate function that many overlook. While T often grabs the spotlight, estrogen, converted from T via the enzyme aromatase, is vital for maintaining libido, erection quality, and genital lubrication. Without enough estrogen, men may experience reduced sexual desire, difficulty achieving full erections, or even discomfort during intimacy. Estrogen contributes to blood vessel dilation in the genital organ by enhancing nitric oxide production, which is crucial for erectile function. Research shows that men with low estrogen levels often have higher rates of erectile dysfunction than those with balanced levels, even if T levels are normal. Meanwhile, too much estrogen, especially when unopposed by T, can lead to gynecomastia, where breast tissue grows, reducing self-confidence and sexual well-being. The key is balance, not just high T levels. Adequate estrogen supports intimacy by influencing brain neurotransmitters related to arousal, maintaining healthy erectile tissue, and ensuring proper blood flow. Men often improve their performance by addressing hidden estrogen imbalance rather than just focusing on T. It's time to rethink the hormone model and give estrogen its rightful place in male vitality. 2. Bone health. Adequate estrogen is crucial for bone health in men, just as vital as T levels. Osteoporosis and bone fractures are often discussed as women's issues, but men can suffer even more severe outcomes due to undiagnosed low estrogen. Estrogen helps regulate bone remodeling by balancing the activity of osteoblast, the bone-building cells, and osteoclast, the bone breakdown cells. Low estrogen levels in men lead to diminished bone mineral density, increasing fracture risk even with minor falls. Men with normal T but low estrogen can still experience weakened bones over time. Epidemiological studies show that men with estrogen in the lowest quartile have significantly higher rates of hip and spine fractures than those with balanced estrogen. Estrogen also helps maintain collagen production in the bone matrix, improving elasticity and strength. It supports calcium absorption in the gut and reduces bone resorption by inhibiting osteoclasts. Moreover, estrogen promotes vitamin D receptors and improves bone mineralization efficiency. Ensuring adequate estrogen in aging men can be as vital as maintaining T or vitamin D. Men concerned about bone loss should monitor both T and bioavailable estrogen levels, especially after age 50. Lifestyle factors like weight-bearing exercise and nutrition can help optimize estrogen-mediated bone health and prevent fractures. 3. Heart health. Adequate estrogen does more than support bones, it's a powerful ally of heart health in men. Estrogen helps maintain healthy cholesterol levels, balance blood pressure, and protect the vascular system. Men with low estrogen often show higher levels of LDL cholesterol, lower HDL, and greater arterial stiffness. Estrogen helps regulate LDL receptor activity in the liver, lowering bad cholesterol and increasing HDL, the good cholesterol, that helps clear dangerous lipids. It also supports nitric oxide production, which relaxes blood vessels, improving blood flow and lowering blood pressure. Low estrogen correlates with endothelial dysfunction, meaning arteries lose their ability to dilate properly, setting the stage for hypertension, atherosclerosis, and heart attacks. Furthermore, estrogen has anti-inflammatory properties that protect blood vessels from plaque buildup. It reduces C-reactive protein and other inflammatory cytokines. Men with balanced estrogen show lower rates of coronary artery disease than those with low or high estrogen, even at the same T levels. Age-related estrogen decline can happen in men, especially those with low body fat or on aggressive T therapy with aromatase inhibitors. Keeping adequate estrogen isn't about raising estrogen, it's about keeping T levels in a healthy range with natural aromatization. Optimizing estrogen balance helps protect blood vessels, reduce heart disease risk, and support long-term cardiovascular health. 4. Muscle maintenance. While T takes the spotlight for muscle growth, adequate estrogen plays an equally important, but less recognized role in muscle maintenance and strength. Estrogen supports muscle repair and regeneration after exercise by modulating inflammatory responses and enhancing satellite cell activity. Women have long been known to retain muscle mass better than men during age-related hormone decline, partly thanks to estrogen's protective effects. In men, low estrogen correlates with faster sarcopenia, the age-related muscle loss, even when T remains steady. Estrogen helps maintain type 1 and 2 muscle fibers by reducing oxidative stress and activating repair pathways. Estrogen also enhances insulin sensitivity and supports muscle glycogen storage. This means muscles recover faster and respond better to resistance training. Men with balanced estrogen often experience fewer injuries, better endurance, and improved strength retention with age. Balancing estrogen naturally, through weight-bearing exercise, proper nutrition, and healthy body fat, supports T conversion and promotes optimized muscle performance. Ignoring estrogen can lead to plateauing performance and lost muscle mass despite continued training. Remember, muscles thrive on hormonal synergy, and adequate estrogen is a key ingredient. 5. Mood. Estrogen influences mood in men more than most expect. It modulates serotonin, dopamine, and GABA pathways. Low estrogen can result in mood swings, irritability, and anxiety, even in men with healthy T levels. Estrogen supports serotonin receptor sensitivity, which boosts emotional resilience and calmness. It also regulates cortisol response, helping men handle stress more gracefully. Men with low estrogen report higher rates of depression, harsher stress responses, and irritability. Studies show estrogen levels correlate with mental clarity, calmness, and contentment. Men in trans clinics transitioning from T to estrogen report marked improvements in anxiety and mood, but they also highlight how low estrogen can harm emotional well-being. Men who optimize estrogen alongside T, without exaggerating, often say their mood stabilizes, stress levels drop, and mental clarity returns. This emotional stability supports adherence to diet, training, and better life balance. 6. Fertility. Adequate estrogen supports male fertility through surprising mechanisms involving sperm production, motility, and accessory gland function. Although estrogen is often viewed negatively in men's fertility, small physiological levels are essential for healthy reproduction. Estrogen receptors exist along the epididymis and testicular tissue, where they regulate sperm maturation and movement. Men with low estrogen often have impaired sperm motility, lower sperm counts, and reduced semen volume. Estrogen also modulates Leydig cell function and T production. Too much or too little estrogen disrupts the feedback loop of the hypothalamic pituitary gonadal axis, affecting how much T is available for sperm creation. Research shows infertile men often have lower estradiol to T ratios than fertile men. In some cases, normalizing estrogen improves sperm parameters, even without changing T levels. Estrogen supports semen quality and reproductive hormone balance, making it a critical, yet often overlooked, fertility player. 7. How to measure estrogen levels. Measuring estrogen levels in men requires more than standard testing, it requires precise estradiol assays. Most labs measure either total estradiol or free, unbound estrogen. Ideal levels in men range from 20 to 40 picograms per milliliter, though optimal ranges vary by age and health goals. Getting tests during the morning, when hormone levels peak, helps improve accuracy. Pair the test with total and free T levels to assess the critical estradiol to T ratio. Hormone testing panels through endocrinologists or specialized wellness clinics provide these insights. Repeat testing every 3 to 6 months, especially when adjusting hormone therapy, weight, or medication, to confirm estrogen balance is within the optimal range for health and performance. 8. Keep good estrogen levels. Maintaining optimal estrogen involves a combination of diet, exercise, and lifestyle. Healthy body fat, of 15 to 20%, ensures sufficient natural aromatase activity without excess conversion or deficiency. Strength training and cardio support hormonal balance without disrupting metabolism. Include zinc, vitamin D, fiber, and anti-inflammatory foods to support hormone metabolism and estrogen clearance. Avoid alcohol, sugar, and endocrine-disrupting chemicals in plastics or personal care products. Avoid unnecessary aromatase inhibitors, which can cause low estrogen. Men on T therapy should monitor estrogen and adjust dosing, injection frequency, or adding very low-dose natural aromatase support if needed. Work with a qualified clinician to maintain functional estrogen harmony for long-term benefits. In conclusion, estrogen in men is far more than a female hormone. It influences intimate performance, bone strength, heart health, muscle performance, mood, and fertility. Ignoring estrogen levels can silently sabotage your well-being, even with high T levels. Understanding and balancing this hormone could unlock massive gains in longevity, vitality, and performance. Thank you for tuning in to Levitas. Please share today's video with friends and family, comment, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated. It helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So, stay healthy, stay happy, and keep going.